That's pretty cool. So they're talking about the Fraxel laser. Tell us a little bit more about that. What is the recovery time for a Fraxel treatment, and how many treatments do you need?
Well, it depends on you. Well, it depends on what your skin looks like and what your downtime is. I mean, the first thing I look at when I look at a patient is, well, how bad are your wrinkles? I mean, if you're one of those ladies with really deep lines, then sometimes these fractional lasers might not be for you. But if you're younger and your lines are a little bit less, then you might have a great result with a fractional device. And generally, I try to keep the fractional device's downtime to about a weekend, so that you can come in on Friday and by Monday you're looking pretty good and you don't lose a lot of time at work. If you're looking for something more aggressive, then we'll discuss some of the more aggressive type of lasers that really take off more skin and give you more downtime.
So if I have fine lines, Fraxel might be an option for me?
Absolutely.
How about if I have dark spots on my face?
Well, with dark spots, we use different devices. We might use broadband light, or also called intense pulse light, which is nothing more than a big, intense flashbulb type device. And that's good for removing dark spots and some superficial or light vasculature on the face. Some rosy cheeks are good to get rid of as well.
Now, obviously with all these different lasers out there, what would you, if I'm interested in doing fractional laser resurfacing, who do I need to go to have that done?
Well, that's a tough call because there are a lot of excellent laser practitioners out there. I mean, as a board-certified plastic surgeon, I'd love it if you came to me, but there are also excellent dermatologists and other laser practitioners out there that really know what they're doing with these newer devices.
Well, that's very cool, and I think we have some things maybe even cooler when we come back. And when we do come back, we'll learn more about what lasers can do to erase skin damage, including some of the decisions we may have made when we were younger. Stay tuned with us, and we'll be right back. Hi, I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Last year, more than 350,000 women decided to get breast augmentation.
It helped me understand what my body would be like after the surgery.
And speaking of hard facts, let's talk about your olfactory organ.
So a prospective patient, when they're looking to have surgery, must always understand that every single surgical procedure has its import, and they must be concerned with the quality that's being delivered to them.
Each year, more than 200,000 Americans undergo weight loss surgery. 200,000 people looking for a fresh start. The Weight Loss Surgery Channel is the world's first online television network devoted exclusively to the weight loss surgery community. Find the information, support, and guidance that can keep you on the road to success. You'll find it all online, 24 hours a day at the Weight Loss Surgery Channel.
Hello, I'm Dr. Lou Bucky, and you're watching the Plastic Surgery Channel.
Welcome back to the show. We've been talking about lasers and how they can be used to erase things like fine lines and scars and sun damage, and generally give the face a more youthful look. Now, Jason, lasers can also be used for a lot of other applications, like hair removal. Tell us a little bit about that.
Well, I'm a great example, right? Anyway, in terms of lasers for hair removal, most of the devices out there started out as being able to be used only on light-skinned patients with dark hair. But as laser technology improved, we're able to treat darker-skinned patients and patients of color. As a matter of fact, the U.S. Navy has hair removal lasers on their battleships and on their aircraft carriers, because there's a lot of African Americans who get curly hair that's in their beards that become ingrown and become a problem. So there's a lot of lasers out there that we use for hair removal on the legs and the face. And it's really progressed over the last few years to the point where you can use them on many different types of patients and cause very few problems.
Does it work?
Works great.
Really? So how many, let's say a patient wants to do laser hair removal on her legs. How many treatments? How long is each treatment? What result can she expect?
Well, we consider this laser hair reduction because the results are not completely permanent. You may get some regrowth and you might need some tune-ups down the road. But in general, probably about 6 treatments are used, maybe spaced about a month apart. So after a 6-month period, you're pretty good with not a lot of growth on your legs. But it is a process. You need to come in, you normally get some numbing cream placed on your legs, and it hurts a little bit.
So you're an expert in this area. What would you recommend a patient that wants to do laser hair removal? What should they know before they go in and have the treatment?
Well, the problem is that there's a lot of unqualified practitioners out there with cheapo devices. So the one point I'm going to make is don't buy on price alone, because that $15 hair removal might cost you thousands and thousands to fix the problems that might occur.
Really? So tell us a little bit about that. What type of problems have you seen with laser hair removal?
Well, you can get burns, and you can get pigmentary problems, you can get imprinting of the laser beam, and that's just choosing the wrong device for the patient's skin color, or perhaps a poor cooling system or too much energy. So people who do this need to be relatively experienced to avoid these type of problems.
And is all skin types applicable to laser hair removal?
Yes, you can treat from the lightest of light to the darkest of dark if you have the appropriate device and the appropriate training.
Yeah, I think, and again, it's always been a common theme here on Plastic Surgery Talk that, you need to go to the practitioners, board-certified plastic surgeons that have the training and can make the right treatment decision for you. Another subject I'd like to switch to is tattoos. So I heard a statistic recently that over 50% of people under the age of 25 have a tattoo. Do you have a tattoo?
I don't think so. Do you?
No comment. So even Barbie these days has tattoos, believe it or not. It wasn't like that when I was growing up, but if she has a tattoo and doesn't want it, it's really easy to remove that. But what do you do if you have a tattoo and you don't like it anymore?
Well, the problem I have is, when Barbie comes in and she has Ken tattooed on her arm, then the problem is, how many marriages end in divorce? She's done with Ken and she married Steve and she's got Ken on her arm. So that's where tattoo lasers come into effect. The best thing is if you have a dark tattoo or an amateur tattoo. Like last time when you were in jail, didn't you get a tattoo when you were in jail? Those type of devices, those type of tattoos are easy to remove.
Let's make sure we don't invite him back.
But the multicolored ones and some of the ones that are red and green and yellow can be a little bit more difficult.
I definitely we want to come talk about some of the details, but let's see what folks on the street are saying about their tattoos.
I have 6 tattoos, actually.
And you've thought about having them removed?
Yes.
I've kind of thought about getting it removed, but I don't know. Looked into it a little bit, but never made any definite decisions on it.
My tattoos I done when I was in my adolescent years and I got older.
And what is the reason that you think about having it removed?
It's ugly. I don't like it. It's not what I wanted.
Because, I know through time it's going to really make my skin look real bad, and I was young at the time, and I really didn't know. I wanted to follow the crowd, so I don't really like them.
I feel like it'll be better that they're removed because, people will see them and think differently about me and not really know the real me and judge me by my tattoos.